stand over here. We can
Well,
stand
Senator
here.
Hagan, you are a powerhouse, and we are so glad that you're on our team for Smart Power, so thank you.
Still not on.
Well, it's still not on? We on yet? Not on. We'll stand here.
Stand here, it's fine.
We have a very brief, just another story to share with you, and then we are very excited for our keynote address. Wanted to tell you that over the last year, we launched at the USGLC something we're very excited about called Innovations in Smart Power, where we are bringing the stories of these fabulous public-private partnerships that you've been doing for a long time here in North Carolina, all around the country to show spotlights about how public-private partnerships are making a difference around the country and around the world. So I want to introduce you somebody that you probably already know, but I just got to meet, Dr. Bob Melkin, who is the professor of biomedical engineer, a director of Duke Engineering World Health, and he is the inventor of this picture right over here called the Pratt pouch. So when I looked at it and I first saw this, Bob, it looked to me like a McDonald's ketchup packet, but instead of the little golden arches, there is the university crest. So share with me, what is innovative about this little pouch called the Pratt pouch?
Yeah, absolutely. Thanks, Liz. So the Pratt pouch deals with a problem that many people are familiar with. There's like 300,000 or 400,000 children a year who are born HIV positive because their mothers are HIV positive. And if they end up delivering at home at the moment, there is no way for them to get access to a medicine which could prevent the transmission. The Pratt pouch, a small foilized polyethylene pouch, as you said, it's very similar to a ketchup pouch, allows the mother to simply open the pouch when she gives birth and drip the medicine into the child's mouth, preventing the child from becoming HIV positive.
So I'm a mother of two, and I can't, as I talked to Bob on the phone when we first connected, I couldn't think of anything that would be more upsetting, more concerning and painful than not being able to stop your child from a life-threatening disease. So one of the questions I asked you is, how did you come up with this idea?
Right, so, normally as a mother, you're probably aware you medicate your child with a spoon or a cup. It's the syringe, perhaps. It's the standard method to deliver medication to a young child. Unfortunately, those methods destroy the medication in this case. So I asked my undergraduates to look into the problem. Why is it that these standard delivery methods don't work? And within about a year, the undergraduates at Duke were able to figure out not only why it wasn't working, but also a possible solution, the Pratt pouch. We became very lucky. We partnered with an organization in Utah called FlexPack. That company helped us perfect the design, and we ended up with this 5-layer polyethylene foilized pouch.
So somehow undergraduates, McDonald's ketchup, a small pouch, I get it. But one of the questions I had is, how do you get this Pratt pouch all the way to these women and children on the other side of the ocean?
Right, it's a great question. Well, first of all, it's a small package. This small pile of Pratt pouches is enough to treat 30 children. So it's a very small package. But the key thing to understand is that the package is sent into country. The pharmacist locally fills the pouch, delivers it through the traditional birthing assistants or community health workers to the mothers in need. We've been very fortunate to partner with a local training organization called IntraHealth International that's delivering training actually for right now in Zambia, for example, from pharmacists to community health workers. They also go out and train the mothers. So when the mother takes the pouch from the pharmacist home, again, she can just open it up and medicate the child.
So last question. One of the things that people ask me all the time when I'm traveling around the country is, why do you need government? Why does the U.S. government need to play a role? Shouldn't the private sector take care of this? You have been in a partnership with the U.S. government. Does it matter?
Absolutely. So the way to think about us is basically we're a technology startup. We're a small company trying to get a product off the ground. And our product is targeted towards HIV-positive mothers who deliver at home. It's very hard to raise funding for a company like that. Fortunately, we've been lucky that USAID has been willing to fund us through the Saving Lives at Birth project. We just received a second round of funding from them. We're hoping to receive a third round. It's been critical for us to develop this idea into a product where we're having clinical trials now in Ecuador, and we hope success throughout the world.
Well, we hope success throughout the world.
Thank you very much.
Please congratulate Dr. Bob Melkin. It's wonderful.
Thank you, Liz. Thank you very much.